So we went to clinic yesterday, and the doctor was talking about steroid injections. All right, and one of the things he said about steroid injection is a woman was actually under steroid injections for fertility. Now, the thing now led to some issues, like it led to some hormones shooting up in the body, even though she wasn't pregnant. Do you understand? So I was just curious. So I was just trying to say, oh boy, let me come and check for this steroid injection. What are the other uses of steroid injection in gynecology and obstetrics? So that is what actually led me here. So looking at these steroid injections, particularly are talking about corticosteroids. Now let me just sound this. I've known steroid injection in orthopedics, okay, and the uses of steroid injection in orthopedics was more of like to treat all those inflammatory conditions of the joints mostly. So I was just curious, let me just know the use in obstetrics and gynecology. So just so you know, their importance in gynecology and obstetrics, especially when it comes to managing high-risk pregnancies and some certain gynecological issues. So what are their applications? So you can be giving it when the woman is pregnant, that's before she gives birth, so that the baby's lungs mature well. That's if you are seeing that there's a possibility that this woman will give birth to this baby before the baby matures, okay, you can be giving it so that the lungs mature, so that even when you bring out the baby don't actually have issues with breathing. So benefits: it reduces the risk of respiratory distress syndrome, lowers the chances of intraventricular hemorrhage, necrotizing enterocolitis, and neonatal death. All these are complications of giving birth to babies before they are mature. So it's used elective. It's used before elective cesarean section. So in some cases, steroids are given before elective cesarean section between week 37 to 39 to reduce neonatal respiratory issues. Elective is more of like, oh, it's a mother that wanted the cesarean section. Do you understand? Because you know that push as the baby is struggling, that's the first hustle of life. It helps to kind of like prepare you to breathe. So if the baby doesn't have to pass through all those hustle, okay, then you give steroid injection. Do you understand that kind of thing? So in gynecological, non-pregnant uses can be used to manage autoimmune and inflammatory conditions like pelvic inflammatory disease, lupus, okay, inflammatory bowel disease. So also treatment of severe endometriosis, that's issues in the endometrium, okay, to reduce the inflammation and pain that usually happens there. Then post-surgical inflammation. So administration and safety is usually given intramuscular injection. It's in orthopedics that are giving it directly into a joint. Do you understand? So that's just the difference. So a full course involves 2 doses over 24 to 48 hours. Okay, so side effects may include elevated blood sugar, fluid retention, or temporary mood changes. So that does it for the use of these steroid injections in gynecology and obstetrics.